Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Michelle Moran. She's Chief Growth Officer at HCTec, and Dr. Jitendra Barmecha. He's Senior VP and Chief Information and Digital Strategy Officer at SBH Health System. Welcome, guys.
Thank you.
Thank you so much, John. Thank you for having us.
Yeah, excited for this discussion, and hopefully I didn't slaughter Dr. B's name too bad. I appreciate you being here and your kindness, but let's start off, Dr. B. Could you please introduce yourself and share a little bit about your role at SBH Health System, St. Barnabas Hospital?
Sure. Before I do that, I think it is important who we are. So SBH Health System is over 156 years old, independent hospital health system, mostly serving South Bronx. And it's a safety net organization, and we serve underserved population. We are 431 acute care licensed bed facility with academic programs, trauma center, and we do have our own insurance program for over 30,000 risk contracted lives. Very large academic medical health system, including a medical school affiliation as well. As far as I'm concerned, it will be 28 years this year. I started as an intern, Department of Internal Medicine, and I stayed on at SBH Health System. As you pointed out, John, I'm the Senior VP now and Chief Information and Digital Strategy Officer, leading the digital transformation journey.
Awesome. Well, I appreciate all the work you're doing. I think safety net organizations don't get enough credit, so I appreciate all the great work you and your team are doing. And Michelle, tell us a little bit about yourself and and your work at HCTec and together with St. Barnabas.
Thank you, John. Michelle Moran, and I'm the Chief Growth Officer for HCTec. I've been here for 42 days, and I'm pretty excited about the opportunity to solely serve the healthcare vertical. I've been in the technology industry for over 30 years. The reason I'm at HCTec is because we are really focused on the entire ecosystem that CIOs like Dr. B focus on to serve such critical scenarios like what he just described to you. So when it comes to choosing your EHR, going live, supporting it, both short-term and long-term with staff augmentation, application support, training, whatever it takes to make our clients successful in this space is what we focus on with all of our certified employees in staff augmentation. So we appreciate the opportunity to talk about this today.
Yeah. Well, Dr. B, chime in here about your experience and your partnership between, St. Barnabas Hospital and HCTec. What's your perspective on this partnership?
So far, it had been excellent, I would say, not even good, excellent. So we had to overhaul our entire infrastructure on technology side for our digital transformation journey. And our EHR and the ERP systems were not modern. And so about 18 months ago, we made a decision that both our ERP system as well as clinical application needed to have an overhaul. So it was a 9-month project last year. We did implement Epic and Oracle together. Hindsight, not the best thing to do, but I think we did it with the partnership from HCTec. And I would say we had a 3-prong approach as far as HCTec is concerned. So during the activation, they became our help desk, our customer support. And within, I would say, 3 days, we were able to implement a software which had CRM functionality called Zendesk. Okay. And we couldn't have done without the leadership at HCTec and the staff at HCTec. So not only the human capital from HCTec was activated, we also implemented the technology so that it was better documented and the performance and so forth. So that was one prong. The second prong, what we did was on the patient-facing side, which is the patient portal MyChart, which is a 24/7. And as I said in the beginning, serving the underserved population, we always have digital divide or digital equity in our mind. So we wanted a bilingual staff who can onboard or help or assist our community members for onboarding of Epic MyChart patient portal. So that was the second prong. And the last, equally important, the third prong, as Michelle mentioned, was the staff augmentation. So we do have few staff from the HCTec who are at the application level, who are being certified, and we can only see that this partnership grows even further in terms of staff augmentation and kind of managed services. So again, three-pronged approach. We are very pleased with it. We could not have asked a better activation. And again, both from the human capital side and as well as technology side, it has been extremely good for us.
Well, I want to go back to the fact that you're a brave soul that did ERP. It sounds like Oracle was your ERP and Epic was your EHR, and you did them all together. You talk about that decision to switch those and both at the same time. I mean, that you must have been suffering from a lot of challenges to say, hey, we got to do both.
Correct. So ERPs are the unsung heroes in healthcare industry. And I'll be very honest with you. The spotlight or the microscope is always on the clinical side. Mm-hmm. Doctors, clinician, nurses, documentation, clinician burnout. But to have a total cost of care or improve overall quality or to be more cost efficient and high achievers, we definitely have to look at the ERP, especially supply chain. And if you are doing any procedures, you have to make sure your supply chain is robust, your ERP system is robust. Same thing on the human capital side. I mean, if you want to have real-time augmentation of staffing in certain area, your payroll system, your human resources functionality has to be robust as well. So for the supply chain or the materials management decision, we had to do at the same time. And also it is one of the best practice from Epic that the procedural modules or the application in the Epic, if you have the ERP already implemented, then it becomes much easier when you're going into the procedure rooms or the OR rooms in terms of supplies and all. So it happened organically. I would say it was not our decision in the beginning. We wanted to go first with Epic and then Oracle, but because of we had to re-engineer very quickly on our project planning, and then we felt that, okay, let's do the ERP first and then we go live with the Epic. So on October 1st last year, we went live with Oracle, and then on October 28th, our big day was on Epic Enterprise Solution.
Impressive. Wow, Dr. B. Michelle, I mean, HCTec has a lot of experience in go lives with Epic. Talk about your perspective on people switching to Epic and supporting the rollout. Luckily, I'm sure many don't do ERP and, and EHR at the same time. But what's kind of the HCTec perspective on this switching to Epic?
Sure. So there are a lot of things to consider when you're switching to Epic or any other EHR. So our job is to understand the entire ecosystem, the impact, and the position that the CIOs are in to serve both their business, the clinicians, the patients, their business partners, and ensure that their brand is protected along the way. So we become very advisory, and it's why we have really the best teams in place that are certified and qualified. They're not new to this type of transition, so there's a lot of strategic discussion that takes place so that we understand where they are today, where we can take them in the future, what their options are. You know, when you're going to Epic, you can go to Epic in the cloud, you can go to Epic in the public cloud. It can be in an infrastructure on campus for that particular hospital. So there are a lot of options out there. So our teams are equipped to work through those options and to think about the teams around it. So keeping in mind that this is usually a project that not everybody experiences every single day. So it's really important that it's like an operation. You want somebody who's done this over and over again so that you can have success in the end, or that the team is able to respond quickly in case there is a glitch, because, you know, there are all different factors that can affect a process like this. So when you have a high level of communication between the hospital team and the CIO and our team, it becomes successful, just like Dr. B just described. You know, that back and forth and that reciprocal partnership makes all the difference in the world.
Dr. B, what would you add? I mean, you know, there's a lot of options I'm sure you had available to you as you were choosing a partner to implement Epic. You know, what kind of stood out for you with HCTec to, you know, give you the confidence to partner with them?
I think our strategy, as Michelle mentioned, was already aligned when we chose HCTec. And again, serving in the South Bronx, underserved population, cost is always very, very important for us. We host our own application, which is Epic on-premise, and we used to host our previous application also. Oracle, we didn't have any choice. It's cloud-based. So having both cloud-based and on-prem, and as Michelle mentioned, this is a whole strategy. You can collaborate or partner and discuss. And if you have to re-engineer certain workflows, they are available, their staff are available. So again, I just echo what Michelle just mentioned. And this is the year people don't change these infrastructure on a regular basis. It's probably once in 5 years, 10 years, or 15 years. So a lot of thoughts.
It's interesting to think how old the ERPs are. Everyone's switching them out, it feels like. And so it's like, how many years for the EHR? Probably a lot, right? I think that's, you know, it's a long-term commitment that you're making, you know, as an organization. You know, what did you do to ensure that this project was successful? Michelle talked about communication. I think that's an interesting one. You talked about setting up some software to manage it better. You know, were there some other keys to ensuring that this was a successful project for you?
I think I agree with Michelle. I think communication is key. Whether it is communication within your team or within the health system or within the community partners or the vendor partners. I mean, if you look at the list of third-party vendors, I mean, although we have an enterprise solution from Epic, but there are still FDA-based applications and other vendors we have to communicate. So communication is essential. From the end user side, I think training. I mean, training is never enough. We spend and considerable time and the resources on the training, making sure that not only post go live or during activation, but also when we were in the design session, because we didn't want to bring back the old or bad workflow into the new system. So training is again very, very essential. So communication and training, those were the two big pieces. And even in the optimization, we'll continue to have our training.
Yeah. Well, how did you approach the training? It's kind of interesting. You're in this kind of post-COVID Epic go live world where COVID opened up all these remote opportunities. Did you use some remote support? Did you use at the elbow? You know, how did you approach that?
So combination, as you mentioned, we did have end user training by Epic virtually. Then we have our own small division of training team. And we had elbow support during the go live. And now what we are doing is, now that we are almost 6 months post go live, We are also looking again for the elbow support, as well as Epic, what they call it as on-site Thrive training. And then we are also augmenting with our own in-house training modules being developed so we can put it in our learning management system. So again, combination of 2 or 3 different types of training so that we touch all our basics.
Interesting. Michelle, feel free to add in on the training, but I also love to hear any thoughts about, what it's like to provide the support to your partners on these large scale projects. I mean, Epic people are hard to find, like that's just the reality of the market. What's the key for HCTec to be able to provide this kind of support?
So because of the level of experience that we've had over the last 10 plus years in providing these types of resources to the healthcare vertical in the marketplace, we're very good at figuring out the skill sets that are necessary to make these projects successful. So whether it's staff augmentation or it's our team assisting with go live, providing that training at the elbow, thinking about long-term and short-term, what's going to make a successful formula. I would commend Dr. B because, he recently has added a lot of expertise, both permanent and in a contract fashion with various levels of skills to supplement what he's already put in place. So, we work with our clients to make sure that it's very well rounded. And we're able to do that because we understand their ecosystem. We understand that you choose your EHR, you have to have the right people in the right place, whether it's temporary or long-term. We have a team that supports Epic application, both short-term and long-term. In fact, we've taken organizations from a rating of 4 and a rate card to a 10 just by jumping in and supporting their team, both short-term and long-term on the application end. It's really important that you understand the whole ecosystem and that you can meet the client where they are. So some people use us for everything. Some people use us for pieces and parts of the portfolio that we offer. But the key is the right people in the right place with that experience level. We're very meticulous about those components.
That's interesting from the ratings. Was that ratings of the clinician users and the end users of the Epic system, or what was the ratings from?
It's the Epic rate card, the performance of the application.
Oh, got you. From Epic. Okay.
Yes.
Interesting. Yeah, I mean, what's your perspective, Dr. B, on how this has impacted the clinician and the patient experience, switching in both Epic, Epic, I think hits the clinical side more, ERP is more kind of the back end, but, how has their experience changed, both the clinicians and the patients?
Overall, it has been wonderful. I mean, I do practice medicine and I use EHR every day. And I use Epic every day. So again, the information is in the right place. It's very easy to toggle between the information within the Epic. It's a good communication between the caregivers or patients and the providers. So far it has been good. We just completed our first double version upgrade on May 4th. And it was surprisingly very seamless, less than 39 minutes of downtime, which we never heard when we in our prior EHR. And one thing I want to echo, Michelle, not only we did good for Epic implementation, we received Gold Star actually, which is the highest award for any Epic implementation. So again, we could not have done without the partnership with HCTec and Michelle's staff. And overall, I think from the end user side, whether they are in the operations or revenue cycle or admitting or ancillary or clinicians, everybody has been very pleased. We are in the optimization phase. And again, the more training we get after the upgrade, we had some new features. So again, it's a journey. We have not reached our destination yet.
I
Yeah,
mean, you're bringing,
it's not just gonna stay where it is, it's gonna evolve.
Yes.
yeah,
So, our goal is to always adjust with the client as they evolve. Right now, if you think about it, we're offering, handling the MyChart piece of it and answering to the patients who are interfacing as they, moved into the Epic module. So, and then in addition to that, Dr. B and his team implemented general service desk. So we were keeping everybody busy, keeping them focused by, even if it was changing passwords so that his team could stay strategic, as they made this migration. So it's, the unique combination for each organization. And in Dr. B's case, it was, MyChart service desk at the elbow, go live. And now the long term, who are the people that we need to keep this engine going and keep refining it? And we'll be with him in every step of the way. We appreciate the opportunity.
So John, I want to add something, Michelle, on the patient side or patient-facing side. So in our previous EHR, I mean, it was just a checkbox for the meaningful use that patient portal is there. And we had the uptake of probably between 5 to 7% give and take. And 5 for the patients and 2% were our own staff who were using it. So,
well, you only had to have one, so you were exceeding the bar of meaningful use.
correct. But with the Epic MyChart, it has become kind of a business process for us. And HCTec having bilingual staff, which is very, very important in our community. It's not only onboarding, they also try to navigate if they have any revenue cycle issues, they have appointment issues. So again, it had been, I would call them as an extension of our SBH staff. If I have to use the strong words here. So it has been very good for caregivers as well as for the patients on the patient-facing application that MyChart is as well.
Yeah. No, I mean, I think it's interesting. We look at something like a password change and be like, well, how is that important, right? That's easy. But if you can't get in, if whether you're the patient or the clinician that needs that password reset, it really is mission critical because you need the password access. Go talk to some of the EHRs that are down because of a breach, and you'll know how important that is, right? So, but yeah, I mean, to Michelle's point, but do you want your staff doing something that's a pretty mundane task, right? Like essential, mission critical to your organization, but very mundane. I think it's fascinating to consider how important it is, and yet it's a pretty simple task, let alone, the more advanced task of kind of navigating the patient a bit through the revenue cycle process. That's interesting.
And John, it is very, very important from the patient experience side. Yes, we can control their blood pressure with medications or insulin for diabetes and all, but these small nuances of not having been able to access into the MyChart. So the whole patient experience, similarly to our flight journey, we want to make sure that they are very happy with their, because they come to us in a very vulnerable time, especially for acute care. But when they are in the wellness center or the ambulatory care, we want to make sure that the tools which we have in place works also very seamless, so that overall experience is much better.
Yeah.
Yeah. So imagine how anxious a patient is when they're in that situation. Our team looks at it like if they have an issue and they can't get in, we need to resolve it very quickly. And that means everything to that person in that moment, but it also protects the brand. And we're supporting our client by making sure that we're responsive with the right people who can give those answers right away.
Absolutely.
So it's a very sensitive time frame, but very important as part of the equation.
Definitely. Well, I imagine the last couple of years has been all-consuming ERP, EHR. They usually are these go lives, right? But as you look forward, and maybe you could start, Dr. B, how do you foresee kind of digital transformation in healthcare unfolding over the next, I don't know, five years or so? And what role, are you going to see other things like automation, AI? Where are you going next now that you kind of you bit off both ends of the apple, the ERP and the EHR. Now what's next for you?
So, John, what we did over last 16 or 18 months was the digital acceleration. Digital transformation, we are not yet there. We wanted to have a good, sound, foundational technology, both on the ERP side, also on the clinical side, and also on our telecommunication side. So for last 2 or 2.5 years, we have been investing a lot of resources and energy. Now that we have a good foundation, whether on the clinical side or the revenue cycle side, now we can utilize those tools, whether those are, as you mentioned, robotic process automations or augmented intelligence tools. So we become more efficient. And 5 years, I think that's a very long. I mean, with the advent of generative AI, and I think we are talking about in months, 12 months or 24 months. And right now, there are very few cases or use cases in healthcare from the intervention side. We are definitely looking on how we can make our clinicians more efficient. Like they don't have to be in front of the screen. We want them to be in front of the patients or doing actual procedures. So anything to support our clinicians, I think those tools will be looked at first. And also on the revenue cycle side, less denials, how we can automate certain processes so that we have better collection of data and the same better understanding of the analytics. And if you have a better analytics, now we can look into predictive analytics as well. But the foundational was very, very important. And we could not have done it in our previous EHR, all we wanted to do, whether from the physicians or the provider side or from the patient side. Now that we have tool in place, we are looking forward to our next step in implementing those tools.
It's a good point. You need the foundation, but you also need them to be happy with the tools they have. Because if you bring a bunch of innovation and you haven't dealt with the existing optimization, users don't like that probably.
John, I forgot to add one more thing.
Yeah.
Majority of the health system in New York area or greater New York area, or I would say across the country, use Epic. So even if there are patient movements for whatever reason, we do have access for the records with the appropriate patient consents. So for example, if our patient have gone to a tertiary or quaternary care center, we do have access to their chart as long as we have consent in place. So the interoperability with this tool is amazing, actually. So I don't want to discount the fact because it's a longitudinal healthcare journey, and it is important that we have access to the health records in other settings as well.
Awesome. Michelle, what would you add? What are you seeing from organizations as they kind of look forward with this new AI automation world that's happening?
So I would echo the same thing that Dr. B just said, just helping proactively take that data, look at trends, and helping get better. So, in a hospital scenario, you're thinking about how can you better serve the patient? How can you help improve what the doctor does quicker? By reviewing the trends and the data. So for us as a provider, we're looking at how our agents are responding, the trends, the types of tickets that we're seeing, how the resolutions are taking place, and sharing those trends with our clients proactively so that they can then use that in their business. So anything that we can do to layer on top of what the hospitals are doing, we're adding right back into that to supplement and do the same thing, because we are also focused on the performance of the clinicians, the doctors, how the whole experience with the patients, and again, just their brand, their deliverables. That's very important to us. So we're layering right on top of that proactively using that data in a secure fashion. I would say security is a big deal right now. So, how do you do all of that securely? So that's a huge strategic discussion from our perspective as well.
Yeah. Can't just
John,
slap
I
chat
want to
GPT.
add two
Go
more.
for it, Dr. B.
Yeah, one is now that we have Epic, we have also implemented a tool or application called Healthy Planet. And
Mhm.
we know that the future is more community-based, population health, and then longitudinal health. So we have developed our own internal processes and workflow so that we can communicate with the peers. So with the implementation of Healthy Planet, which traditionally hospitals they never used to do before. So now the healthcare is moving from bricks and mortars to more in the community-based. And we are looking through the lens of digital divide and the making sure the tech equity is embedded during these processes. And we are very fortunate that we implemented these tools with appropriate partners. And that will be our future, making sure our community are healthier and less admissions in the hospital.
Yeah. I love the term
So,
tequity. Nice. Michelle, go ahead.
so if I could add to that, one of the things that's really on my mind as it relates to us serving our clients along the way, it's that I'm in the process of putting together a healthcare advisory board, and I'll have CIOs from across the country talking about, the most important things that are top of mind for them and how they plan to achieve it. And then, really marrying up how we're responding to the market effectively along the way, but most importantly, sharing that out to the market because, there are so many factors that the CIOs are dealing with, clear from security to data to performance of the applications to the experience of the patient and their business partners. um, you know, it's really important to hear directly from the people that are in these roles on a day-to-day basis so that we can respond. And I think that's what you hear, that the Healthy Planet is helping you achieve that because you're getting that feedback. And again, we're going to layer right on top of that with this advisory board to make sure that we're delivering.
That's great. Yeah, and I'm even calling back to a previous video I did with HCTec and one of your users and how you're applying AI and automation in the help desk to do things like sentiment analysis. I mean, to me, that's the beauty of AI is it's going to be applied everywhere, and it's great to see you all working on that and bringing it to a population that maybe hadn't had it before, because of the situation. So this is awesome. Dr. B, Michelle, I appreciate you taking time to talk with us and to share these insights and perspectives and the brave work you did of ERP and EHR at the same time and supporting your users that way. So I appreciate you sharing that knowledge and insight. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks so much.
Thank you, John. Thank you, Michelle.
Thank you.